Welcome to My Journey in QI, reflections from Martin Cawston, who is Learning, Development and Innovation Lead with Community Justice Scotland. This session was recorded at a Scottish Social Services Council Quality Improvement Learning Network session in August 2024.
Hello everyone, it's really nice to be here today, and I want to say a big thanks to Lorna and to Paula for the invitation to come and speak to you about my journey in quality improvement. And I mean that genuinely, because my poor family, even my children, will tell you with a grimace that I love talking about this stuff. I find it really fascinating, and I do love to talk about it. But I promise today I'll not get too carried away, because after all, this is just my own personal journey in QI, and yours might be very different. I also suspect I'm among friends here, and that you all have an interest in this kind of topic. So in any case, I hope you find something useful in it. So this is where I plan to take you today. I'm going to start off by telling you a bit about what got me interested in quality improvement in the first place. And then, because it's had such an important impact on me, I'll tell you a bit about my experience of the Scottish Improvement Leader Programme, or SKILL, which I was very fortunate to do last year. As part of this, I undertook a quality improvement project. I'd like to tell you about that, including what went well, what were some of the challenges, and maybe offer a couple of bits of advice based on my experience. And then just to finish off with where it's all going now. So I hope that sounds okay to you. So in terms of first things first, how did I get interested in quality improvement? And I've been really trying to think about this, and I think I've pinpointed the moment, but to tell you about that, I do need to tell you a little bit about my background. So my professional career began in the probation service in England, where I trained and worked as a probation officer in Leicester. And this was a very rewarding job, and the training introduced me to a whole world of theory and practice, which encouraged me to take a critical perspective on my work. I knew that I wanted to make a difference with the people I worked with, but noticed that many of the systems I worked in seemed almost perfectly designed to make this difficult or impossible. And the consensus really was, it is what it is. You just got to get on with it. So in 2012, I heard a speaker at a conference who didn't think like that at all. And he led with this slide and a quote from A.A. Milne. Here is Edward Bear coming downstairs now, bump, bump, bump on the back of his head, behind Christopher Robin. It is, as far as he knows, the only way of coming downstairs, but sometimes he feels there really is another way. If only he could stop bumping for a moment and think of it. And then he feels that perhaps there isn't. And here was the perfect analogy for how I felt, bumping along and wondering if that was just the way it was. And the speaker went on to talk about systems thinking. He talked about liberating staff to make decisions about their own work, about managers giving up control and fostering a learning culture, which encourages people to ask, why do we do this? Is there a better way? And in other words, a culture of continuous improvement. And I found that really inspiring. This was all completely new to me, and it really sparked an interest in me in further reading and learning over the years. I know some of you will know about SKILL. You may have undertaken SKILL yourself, but I'd like to just tell you a little bit about that today for those maybe less familiar. This is a programme of training provided by NHS Scotland, which is intended to enable participants to design, develop and lead improvement projects, lead and generate support for change, and provide expert QI support and advice to individuals and organisations. Okay, so I'm really sorry about this slide. The text is small and there's way too much on it, but I did just want to provide a very brief overview of the kinds of things we learnt about on the programme. And I have to say that the format has changed in recent times, but I believe the content is more or less the same. And this is really just an overview about the sort of things we learned about. So I'll just do that now. So it was 21 modules over 11 months, and it was a mix of in-person, virtual, and self-directed learning, alongside which ran my improvement project, which then led to a poster presentation. The kind of things we were learning about were improvement science, this specialism which was developed for the last 100 years or so. Within that, there's the model for improvement, relationship awareness, understanding our own sort of motivations and strengths. We learned about tools to understand systems, the difference between reactive and fundamental change, coaching for improvement, which is really important, measurement, generating creative change ideas, theory of knowledge and testing cycles, the importance of thinking about the human factors and reliability, qualitative data, change theories, like using driver diagrams, and understanding variation using statistical process control charts, which are nowhere near as scary as that sounds, evaluation and logic models. So I know that was just a great big list, but I hope that gives a sense of the amount of theory and knowledge that lies behind QI, and that's that. I think that's and hopefully that's helpful. Okay, so I've told you about how I got interested in QI and what led me into the skill program. I'll just now tell you about my improvement project. So my improvement project was related to the Caledonian system. As I'm sure you're all aware, domestic abuse is a major public health issue and source of trauma in Scotland, as it is all over the world. And the Caledonian system is a court-mandated group work programme designed to address this issue with adult male perpetrators. And the aim of the system is to prevent future victimisation and improve the lives of women, children and men. But does it work? And this is the pivotal question posed by all stakeholders, and answering it requires data. One source of data used to measure change are specialised assessments completed before and then after intervention. But nationally, the recording of this data has been persistently low, with more than 60% found missing on average. So my project was created to approach this reality from a quality improvement perspective in a single local authority. And of course, we use the model for improvement, which some of you will know well, and which broadly consists of a thinking and a doing part. We had to answer these key questions. What are we trying to accomplish here? How will we know that change is an improvement? What change can we make that will result in improvement before going on to having these learning cycles? So what were we trying to accomplish? By Halloween last year, to achieve a 20% reduction in the number of these specialised assessments expected from case managers, but missing from the national database. So that's what we were trying to achieve. Okay, so how did it go? Well, a few things went well. First of all, I think bringing together a group of frontline social workers and other subject matter experts to explore and understand the system was immensely helpful. We used specific tools such as a fishbone diagram to identify root causes of social workers overwhelmed by competing pressures, and process maps to see that tasks were often misunderstood, completed out of expected sequence, or just piled up in the face of other social work priorities. And this provided a great foundation upon which to build. And I think one of the reasons this worked so well was our continuous focus on psychological safety in the group, combined with high levels of participation. To establish our way of working, I used an adapted version of the support challenge matrix drawn from the work of Amy Edmondson, Professor of Leadership at Harvard University. Very briefly, this matrix shows the relationship between two important dimensions for effective learning in groups and organizations. On the one hand, you have the degree of safety and support, running from low to high on the left there, and on the other, the degree of accountability and challenge, running from low to high at the bottom. And at this point, I would like to ask you as a group to contribute. Now, you can either raise a hand and speak take yourself off mute and speak, or you can put it into the chat as well. And I'd like you all just to think about what would it be like to be in a group where there was low safety and support and low accountability and challenge doing improvement work. What would that feel like?
I'll come in here, Martin. We've got Jane in the chat saying demoralising, Joe, avoid.
Yep.
Michelle, chaos, and Ali, chaos as well. We've got Kelly, difficult and pointless.
Yeah.
Katie saying unsafe, so is Alison.
Yeah.
Not important, says June. Unsafe, Tina. So I think there's a bit of a theme. Difficult, says Jane. Unsafe and pointless, Sarah. So there's a bit of a theme there running in your comments there in chat.
Absolutely. So yeah, demoralized. No one really cares in this group, do they? They don't care about you, don't care what you do, whether you're even there at all. So that's the demoralizing sense. It'd be chaotic, going any which direction. So absolutely. So that's really an apathetic quadrant, and really not going to be productive at all. So thank you for those contributions. That's exactly what I think too. What about this one here? So doing improvement work where there's lots of accountability and challenge, but there's really low safety and support. What's that going to feel like?
So Martin, we've got fear in the chat so far. We'll just give it a moment, see if anybody else wants to pop something in. Scary coming up in the chat as well.
Yeah.
Anything else? Yeah, so not a comfortable place at all, a place of fear. There's jeopardy, lack of ideas coming up.
Absolutely.
And uncertain and frustrating and apprehensive just coming in.
Yeah, so quite fearful, yeah. Apprehensive, yeah. So that's a zone of anxiety and threat. You've absolutely identified that. And so how do people behave when we feel anxious and threatened? They withdraw, absolutely.
Defensive, they make mistakes, they feel closed off.
Yep.
Fight or flight.
Yeah, absolutely. So, and we know that even in our brains and bodies, when we feel anxious, we become threatened, the thinking parts of our brains shut down. So, people are unlikely to take risks, aren't they, in this situation, and unlikely to even have the parts of the learning parts of the brain engaged. Okay, thank you for that. Okay, what about this one? This one is maybe an interesting one. What would we like to be? Loads of safety and support, feeling really safe and supported, but there's no accountability and challenge.
Got demoralized.
Demoralized, interesting, yeah.
An echo chamber, a bit of a free-for-all,
pointless,
yeah. Ineffective, or bumbling. I like that word, bumbling. That's not a word you'd hear terribly often. Thanks for that, Angela. Could go off track quickly. Fluffy, there's another good word. And nothing would be achieved.
That's it. So yeah, you could call this the comfort zone, or some call it the cozy club. I don't mind being in a cozy club socially, but when we're trying to work towards improvement, we're trying to overcome really significant problems in our work. As everyone has pointed out, nothing would be achieved. It would go off track, and we wouldn't be getting very far. So you probably see where this is going. This is where we want to aim to be in our improvement work, and this is what we try to work on as a group. And we agreed from the start ways in which we try and keep ourselves in this zone. And at the end of every session, I would ask the project team members to use a unique QR code, which you can see an example of in the top right-hand corner here, to rate the session on those two dimensions, and also provide me with comments about what they liked about the session and what could be even better. And this provided me with continuous feedback, which I could monitor and process how people were feeling. And I do think that looking back, it was this level of group engagement was a major contribution to the results that we achieved. So speaking of which, here's an outcome measure chart of, and what it shows here is the percentage of Fife Council Justice Social Work specialised assessments missing from the Caledonian National Database from April to November last year. There's the percentage missing on this column here from 10 to 50, and then by week ending at the bottom. So it's time at the bottom and the percentage missing there. And as you can see, the mean was around about 42%. And just to be clear, that a down on this chart equals an improvement. So we started testing our change ideas in June 2023, and then in August 2023, we began to see this. We saw a steep trend down towards improvement, and then a sustained shift well below our original baseline, with us hitting our project aim. So this is obviously really encouraging for everyone involved, with one team member telling me that it's great to see what we've accomplished in the form of visible indicators, and it has made the time commitment more than worth it. And that really meant a lot to me, because I really know how busy these people really are. Okay, so moving on, just what were some of the challenges? There are quite a few. First of all, the QI process itself, that sort of structured approach to doing things, it wasn't always easy or comfortable. Social work staff aren't very familiar with it. I wasn't very familiar with it. And some people found it strange or struggled to see the point. And I think the key here was to have faith in the method and the theory that lies behind that, and be willing to try new things together, not to set myself up as an expert, but someone willing to sort of try and learn alongside everyone else. So that was one of the challenges. Organizing the data. And what I mean by this is actually getting hold of the relevant data. And this is perhaps the single biggest challenge of the project. At one point, I thought it was impossible, but thankfully a member of the group did some incredible Excel wizardry, which genuinely saved the project. So it goes to show I couldn't have done it on my own. And finally, just in terms of challenges, this is maybe more of a personal one, but I did experience quite a bit of a fear of getting things wrong, of failing, and just generally looking foolish. And I think this comes back to the fundamental need for psychological safety, where failure is tolerated, in fact, and actually embraced as valuable learning. And I try to continually remind myself of this, and also draw on the encouragement of my fantastic QI mentor and peer WhatsApp groups, who were all amazing and helped me through that. So having been through that, what can I offer in terms of advice? Well, I'm not sure, but here are a couple of things perhaps. First of all is to push at open doors. Setting up the project relied on connections with people I knew would support me and work with me. So I really think it's a good idea to find your friends and use your professional networks. And coming along to sessions like this, for example, I think is a great way of doing that. My other advice is really not to be afraid of testing or to avoid that. Things don't have to be perfect. In fact, trying to make things perfect is often slow and inefficient. The sooner we can get testing, the sooner we can see what works and what things don't work. And that's not to say we should rush into testing without doing the thinking part first, but I learned so much more from testing than I thought I would. So that's the principle of testing fast, and we can fail fast. And generally speaking, it's okay to fail, and we can learn a lot from that. Okay, so just to begin to wrap up, I'd like to tell you about where things are going now. A bit like my daughter in this photo here, I feel like I have a few bits and pieces in my backpack, and I'm kind of heading out into the wild. And these are the sort of places it's leading to me at the moment. Having seen the results in Fife, Glasgow City Council have very kindly agreed to have a follow-up project, which is currently underway. Out of our learning about the challenges facing social workers, the Caledonian System dataset is now being reviewed at a national level, which I do hope will lead to more fundamental change in that area. I've now become a QI mentor, which is a great opportunity to learn from someone else who's going through the skill program, and I'm really looking forward to doing more of that. And finally, later this year, Lorna and Paula have very kindly agreed to co-deliver with me the Scottish Improvement Foundation Skills, or SIFS programme, to staff within my own organisation, which I hope will be the start of a wider spread of QI learning in the community justice sector. And I'd just like to finish with this photo of my Glasgow project team generating some change ideas, and with a recent quote from Jason Leach, the NHS Clinical Director of Healthcare Quality and Strategy, who said that there are 3 basic things that you need for improvement: pals, tools, and courage. And I really can't agree more. So thank you very much for listening, and I'd be really happy to receive any comments or questions.